Hello, my name is Jameson, and I am studying in the human service field, hopefully getting my bachelor's pretty soon, focused towards substance abuse. I'm doing my presentation on the movie A Good 4 Days, and yeah, so here we go. Today we're doing a case study of a young woman struggling with addiction and her mother who has been dealing with her daughter's addiction for 10 years now. Um, we have Molly Wheeler, a 31-year-old heroin addict who has been using drugs and alcohol for the past 10 years and has lost custody of her two children. Just recently, Molly showed up at her mother Deb's house, begging her to let her in to take her to detox. Deb, the mother, who is all too familiar with Molly, has tried to get clean 15 times before, does not want to enable her daughter in any way, so she stands firm and does not let her in. But Molly is persistent and sleeps outside the house. So the next morning, Deb agrees to take her to detox. Molly gets out of detox 4 days later and has to stay clean for another 4 days in order to get a Vivitrol shot, which can block any opiates from getting into her system for 30 days. She will get the shot once a month after that, but we quickly learn that staying clean and sober for those 4 days is not going to be easy for Molly nor her mother, who wants to do everything that she can to help her daughter stay clean in order to receive the shot and get her life and her kids back. When we look at the family systems theory, we look at the family as a whole and how they function together. When treating the Wheeler family, we can see that Molly's addiction has caused a lot of damage and trust issues between each member of the family. This is why I believe that using structural and strategic family therapy would benefit the Wheeler family greatly. The mother has clearly been traumatized by the actions of her daughter, who has lied, stolen, and manipulated during her active addiction. Deb is clearly frustrated with the whole situation, and although she wants to help her daughter, there is a sense of anger and resentment toward her. And the same goes with Molly. So the interactions between the two tend to blow up and become hostile at times, and I believe that working on this communication and setting certain boundaries will help to create a healthier environment for both of these women. We also learned that Molly has a lot of emotions and PTSD from her past, because when Molly was younger, her mother took off from the family for an extended period of time. So Molly holds a lot of blame towards her mother for why she turned out the way she did. The more we learn about Molly, we see that she has a lot of self-doubt and struggles with self-esteem issues. This can be very common with addicts because by the time they are willing to even seek treatment, they have burned their lives to the ground. In Molly's case, she has lost her job, her home, her kids, her boyfriend, and she has ruined all the relationships in her family and destroyed all trust. Considering this and the fact that she has tried to get clean 15 times before, it can be pretty difficult for an addict like Molly to believe in herself when going through this treatment process. This is why I believe that the most important thing to do when working with Molly is to focus on her strengths, to help build up her self-efficacy, to allow her to see that she is capable of maintaining sobriety. You can see in the 4 days she stays with her mom and tries not to use, there's an internal struggle she has with just giving up and going out and getting high. Her mom does everything she can to keep this from happening, but at one point she needs to realize that she can only do so much for Molly, and it's really up to her to stay clean. Working with the Wheeler family is especially hard because of the charged emotions that both Deb and Molly have toward each other. The counselor would try to make sure that during the family sessions, each member got a chance to speak. At times, the discussions could get very heated, and it is the counselor's job to make sure and even cut off a member to allow each member to speak. This may come off as rude, but it may be the only effective way when trying to allow healthy discussions. It is important to empathize with both parties and make sure that they both feel that their feelings are validated. It is very clear that Molly's persistence with wanting to get clean and stay off drugs is very strong. Therefore, her motivation to change has been established. But who's to say this motivation wasn't there the other time she tried to get sober? It is a job of the counselor to identify this motivation and build on it. Use the motivation for both Molly and themselves to better help Molly getting the proper help she needs to stay clean. It is important that Molly's motivation to get sober is out of her own and that she is not doing it to please anyone else. Obviously, she wants to get her kids and her life back, but she will have to want it for herself in order to really continue on with her recovery. On the third day at her mom's house, Molly receives a call from the doctor stating that because of insurance issues, they will need to wait another 3 days. Deb does not believe this is the case, but Molly starts to head into a spiral, seeing that she has to stay clean for another 3 days, which has already been a struggle for these past 3 days. It begins to get to her. It seems that all her emotions and urges start to come back, and she ends up leaving her mom's house with her ex and relapses. Her mother is devastated by this. While she was gone, her mother was calling her, trying to get a hold of her, and she wasn't answering, and she had this bad feeling. But she ends up coming back to her mom's house, and her persistence to stay clean and to get this shot is so strong. But she admits to her mom that she did relapse, and she asks her mom if she can use her urine, because if she ends up taking this shot and she still has stuff in her system, she can go into acute withdrawal. Deb does go through with it and ends up giving her urine. Reluctantly, she doesn't really want to, but she does want to see her daughter get clean. So this is where you see the struggle, where it's like she's enabling her in a way, but she wants her to get clean, she wants her to do better, so she doesn't really know what to do, and she gives in. So she gives her the urine. They go to the doctor. They get back, or she ends up getting the shot. When they leave, she seems okay, and then they get in the car, and then Molly goes into acute withdrawal and ends up having a horrible symptoms, so her mom ends up taking her to the emergency room. But after that, she does seem okay after she leaves the emergency room. She got the shot, so now any other opiates that enter her system, she will not get high. So she ends up staying clean on the Vivitrol shot for the next 4 months. And as the counselor, I would have tried to talk about these emotions and urges with Molly when she started feeling them in the beginning and try to prevent the relapse from happening. I could have focused on the success that she had already with not using drugs or alcohol for the 6 days prior, and emphasize on what a huge accomplishment this was for her and the changes she has already begun to make. Being in treatment and receiving outside treatment can create a safety net while dealing with addiction. But what really happens when you leave treatment, or when clients feel they've gotten enough treatment or therapy and they want to end it? It's important that in Molly's case, a counselor go over some things that might happen with her after treatment. Like what happens when Deb starts arguing with Molly, or what happens when just the everyday stressors come along. Will it cause Molly to relapse? It is important to outline some of these things and the clients with the clients in order to arm them with the proper tools and coping mechanisms to prevent slipping back into the old behaviors and then relapsing. It should be known that if needed, it is okay to return to counseling as well. Just because it ends at one point does not mean you cannot utilize therapy ever again. Knowing the right place to turn can help avoid making a messy situation even messier. Upon termination, it should be clear that Molly and her mom have goals and skills to help them get through their journey of life. That is the real job of a counselor. Along with all of this, there are many services that can help the Wheeler family through these difficult times. For example, mental health counseling is available all over nowadays, even done online. It can be anonymous. This could help both Molly and Deb deal with other issues that they may be having. They also offer housing assistance that could eventually help Molly move out of her mom's house and possibly get some custody of her kids back. There are tons of childcare services and assistance for childcare that could help Molly while trying to get back on her feet. And because during addiction, Molly ends up, losing her job and everything else. She has nothing, no car, no job, nothing. So all these services could help her find a job, get back on her feet, and help her, maintain her recovery and keep it going strong and, get her life back on track. So I felt that the movie was a really good example of, the family dynamics when dealing with a family member that's in recovery, especially like the mom and daughter. You could see that with Deb, she was kind of over it in the beginning. She didn't even want to help her ex-husband or her new husband, Molly's stepdad, I guess, was trying to encourage her to just leave her, don't help her, because they've obviously done this before, and Molly's burned them and stole from them multiple times. So, but it is also important that as an addict, you do have some sort of support system, and sometimes family is the only thing we have left, even when we burn those bridges. So I did feel that this movie was a great representation of that, based on a true story. I recommend you watch it, and thanks for listening to my presentation.